The knee is a very common cause of disability in the world. About 20 crore people in US are suffering from arthritis, and about 15 crore people in India are suffering from arthritis of various joints of the body. It has overtaken about even hypertension for that matter in causing the disability, and is second commonest cause of disability in comparison with diabetes mellitus. The most common, there are about 100 forms of arthritis. The most common is osteoarthritis, which is also known as degenerative arthritis or age-related arthritis. There are other forms also known as rheumatoid arthritis, known as gatia, in common gout, arthritis due to infection, due to trauma. The most common cause is osteoarthritis. In this, the cartilage wears off. There is a joint is formed by two bones, and the cartilage is a protective surface between the two joints. The cartilage wears off, and the patient feels pain while walking. The common symptoms are pain, swelling of the joint, pain while movement. It is difficult to climb stairs. A patient is not able to stand up from the chair or sit down comfortably. Even traveling a distance of 100 meters become an issue with the patient. With time, there is a deformity which develops in the joint, and patient feels crepitus sensations inside the joint, and even patient complains of severe pain in the night, and which disturbs his or her sleep. Coming on to the diagnosis. Diagnosis is straightforward. We get an X-ray of the joint done, and we see that the joint surface, the joint space is decreased, the bone is rubbing with the bone. Sometimes in some cases MRI is also indicated, or some blood investigations are indicated for some gouty arthritis or trauma, in trauma cases. Management is first medical management, physical therapy, and then comes the surgery. In medical management, first we go for activity modification. Patient is advised not to sit cross-legged, stair climbing is avoided, squatting is avoided, and it is seen that obese patients suffer more, so patient with more weight is advised to reduce the weight so that the weight putting on the joint which is causing pain will be relieved. Then there are physical therapies like hot packs, ice packs. Even cycling is very helpful in patients suffering from knee arthritis, because in cycling the patient exercises, decreases weight, but is obviously not putting any weight over the joint, so cycling and swimming are the best exercises. Medical management consists of treatment like painkillers, analgesics, which can be NSAIDs or opioids. Then these are all temporary management. Then comes the intra-articular injections like corticosteroids. The corticosteroid injections, once given, can be helpful for 4 to 6 weeks, but repeated injections are not advised, because these injections can damage the joint themselves. There is hyaluronic acid injections which can be used in grade 3 of arthritis of the knees. These injections, if helpful, can work for at least 2 years. But if everything of these modalities fail, then we have to opt for surgery. Surgery is like arthroscopy, in fact joint replacement is the end surgery or end stage treatment available in knee arthritis. Arthroscopy is done to remove loose bodies, or in early lavage system can be done in early arthritis. Patient become relieved of pain for about 2 years or 3 years, which is quite handy. But if every medical management fails and the joint is quite severely deformed, then we have a total knee joint replacement which has excellent results and gives about 95 to 99% excellent survival rates. It is one of the most productive or most result oriented surgery in orthopedics. The surfaces of the joint which are destroyed are changed and with the special implants, and the patient is able to walk after 48 hours of the surgery. There are implants available now which last for more than 30 years. The new technologies, new techniques have come, like computer navigated system which is being used, and accuracy up to the amount of 100% is being achieved while doing surgeries. The tissue sparing surgeries like PCL sparing surgeries, even bi-ligament sparing surgeries are now available, which if done in a proper hand gives excellent results. Thank you.